Good morning. My name is Dawn, and today I'm going to do a abdomen assessment on my patient. I'm going to go into a room, sanitize my hand, put on some glove, and introduce myself to my patient. And hand sanitize, Dawn on glove. Good morning, sir. How are you doing today?
Okay.
Okay, my name is Dawn. I will be your nurse, and I will be doing a abdomen assessment on you today. Can I have your name and your birthday, please?
Tony Dell, 10-10-71.
Okay, I'm gonna ask you a few questions first before we're gonna start on the assessment. Okay, um, when was the last time you had a bowel movement?
Yesterday.
Okay, and it was a normal, constipated, or diarrhea?
Normal.
Okay, and what is your regular bowel movement?
Every 2 days.
Every 2 day? Okay, and have you had any abdominal surgery in the past? Any past medical history?
No.
Okay. So before we do the abdominal assessment, it will be good if we ask the patient to empty their bladder because later on we're going to do palpitation and we want to make sure that there's no tenderness or discomfort with a distended bladder. So the first thing I'm going to do is I'm going to do inspection. I'm going to ask him to lay down for me. He's gonna lay on a flat surface, maybe a small pillow underneath his neck, and then I'm gonna review your belly a little bit, okay? So we're gonna look for the contour of the abdomen and the symmetrical of the abdomen. We're gonna look underneath. His abdomen is round. The umbilicus is mid way. Is symmetry. There's no bruise noted, no lesion, no rash noted on the abdomen. His skin color is pink, is lighter than his other body part due to the fact that the abdomen is not exposed a lot to sunlight. And I'm also gonna look for the if there's aortic pulsation. You can usually see it in a regular thin person in some people, and I cannot really see it in here, so there's no pulsation. The next thing I'm gonna do is I'm gonna listen for abdomen sound. And I'm going to use the diaphragm of my stethoscope. And you can basically start on any quadrant, but it's recommended to start in the right lower quadrant and then go clockwise. So when we listen for the abdomen sound, you want to listen for any bowel movement sound, and there should be 5 to 30 bowel movement sound per minute. You want to listen for 10 to 15 seconds in each quadrant, and we'll listen for any tingling, any gurgling sound in the abdomen. His abdomen sound are active. And the next thing we're going to do is we're going to listen for the vascular sound, the aortic vascular, the renal vascular, left and right renal vascular, and then the iliac vascular. And we're going to listen with it with our belt of the stethoscope. And the aortic sound we're going to listen is going to be below a little bit, below the sigmoid and above the umbilicus. And then we'll listen to the right renal, the left renal, left iliac, and right iliac. And we'll basically listen for any bruit sound, turbulent sound, and there is no bruit that I could know it. So the next thing that we're gonna do is we're gonna percuss the abdomen, and we're gonna listen for the tympani in all 4 quadrants. And we're also gonna percuss the liver. So with percussion, you want to use your middle finger. You want to tap on it. And you want to listen for tympani around the 4 quadrants. And then we want to locate the liver. So with the liver, you go to the intercostal border. And tap. And when you found the dullness, that's where the liver is. Can you sit up for me, please? And can you turn your back over for me, please? The next we're going to do is we're going to do a blunt percussion over the kidney to see if there's any tenderness over the kidney. Okay, and you want to put your left hand flat over where the kidney is, and then we want to do a percussion tap your right hand over your left hand, and just ask if there's any tenderness when you do this. Okay, let me know if there's any tenderness, okay? Do you feel anything?
Not really.
Okay, I need you to lay back, please. Just move over. Okay. Okay, the next we're gonna do is we're gonna do palpation, and we're gonna do light palpation. We're basically gonna palpate for any tenderness, feel any mass during palpation, and then just let me know if you feel any tenderness, okay? So for light palpation, we're gonna do with one hand, and we want to press down on the abdomen about 2 to 3 centimeters. Do you feel anything? Does it hurt?
No.
Okay. Okay. The next thing we want to do is we want to do a deep palpation, and with deep palpation you can use both hands, and you want to go down to 3 to 4 centimeters. And with this, sometimes you can palpate for the organs. Are you feeling any pain? Okay. Okay. And the next thing that we're going to do is we're going to palpate the aorta and measure the aorta pulsation. So as you see around here, you want to, it's a little slight left above the umbilical. You want to feel for the palpation. And then you want to feel for the border of it and put it against your finger or you can use both of your hand. And the normal aorta would be 2.5 to 3 centimeter. But I cannot feel on his. So the next thing we're gonna do is we're gonna palpate for the liver border, and this can be found underneath the rib cage, mid-clavicle. Can you take in a deep breath for me? Okay. I can feel the border of the liver. With some patients, you cannot feel the border of the liver, but with some you could. Okay, you can take a breath now. Okay. And the last thing I'm going to do is I'm going to check for rebound tenderness. And then let me know if it's hurt, okay? Does it hurt? Okay, so there's no rebound tenderness. So that will conclude the my abdomen assessment.